Today we are talking about hormonal imbalances, and this is one of those videos I usually tell people you really need to watch all the way up to the end and make sure you don't skip some of the sections, because this is information packed. I've tried to make sure that I include as much information as possible because it's highly misunderstood, hormonal imbalances, and we're going to define it. We're going to look at the signs and symptoms, what you can use to tell whether you have that condition already, and we're going to categorize that into females and also males and children, but we are majorly going to look at females because they have more hormones compared to men with only one. Also children, because at one point they are usually affected by this exact cause, and sometimes it can even start when they're still young. And we're going to look at the causes. We're going to look at diagnosis, the possible diagnosis that can be done to identify whether you have this condition, and finally treatment and some of the things that you can do to reduce the effects of hormonal imbalances or completely treat them. So we are really going to pack a lot of information in this video, so make sure you watch all the way. Now, first of all, hormones, these are chemical messengers in your body. They're just messengers. So there is a place where they are being produced and there is a target organ. Now the topic on hormonal imbalances is so wide, it's so huge because we have so many hormones in the body. We're going to a little bit narrow down into sexual hormones, those that usually affect people most of the time. Okay, I'm not saying that others usually don't affect, because we have domino effects. You might have another hormone that's not working properly. It will affect another hormone, and this hormone will affect another hormone, because now, for example, there's a hormone supposed to trigger a certain activity in a certain organ, and then that organ is supposed to produce hormones that will affect another. So, meaning that if you tamper with the original hormone, you're going to tamper with every other hormone down the stream. So, we have those. We're not going to focus mostly on those huge or the wide umbrella. We're going to look at the specific hormones, and these are the sexual hormones. From the mention, the hormones, what are they? These are chemical messengers in the body. So they are just drained into the blood, and then they go to the target organ and give certain instructions. And they're very important, because in case you don't have that, then a certain message will not be passed, and there is no other way of relaying that information to that organ, meaning they are going to have issues with the coordination of the body. Because we have several systems. We have the nervous system, we have the endocrine system, and they all work to make sure that a certain organ is working according to the instructions given by a certain other organ. So we're going to look at them. And in this video, we're going to define the hormones, which we have already done. And also we're going to look at the signs and the symptoms. And in this, we're going to categorize this into men and women and also children. But in children, we're just going to brush through because there are not as many. Even in men, it's only one we're going to focus on today, testosterone. We usually give a lot of effects in case maybe you have less or more of that. But when it comes to ladies, you have so many issues that usually come because they have several hormones, especially the sexual hormones. They can get PCOS, they can have issues with their menstruation, they can have issues with their fertility, a lot. So we're going to look at most of those, the ones that usually matter, the ones that usually come up all the time. And also we're going to look at the causes, what usually cause hormonal imbalances. And also, how do you diagnose, how will your doctor tell that you have hormonal imbalances? And also, how can you even you yourself tell that you have those issues? Finally, we're going to look at the treatments and some of the preventions on how do you live with hormonal imbalances, or how do you reduce the effect. So like I said, this is a really packed video, so you really need to watch all through for you to understand each and everything. Now, first of all, hormones, like we say, they are messengers. So hormonal imbalances is just an increase or a decrease of the hormones. Hormones are supposed to be in a certain range which is given, so you're not supposed to have more of that or less of that. Let's go to the symptoms. First of all, let's look at the umbrella, the most widely applicable signs to everyone. We have weight gain, and this is mostly due to insulin and also glucagon. So if you have issues with that, you're going to either lose weight or gain a lot of that. Now we have the buffalo hump, the one that usually form at the back here. And this is mostly because of cortisol hormone. And by the way, I'm looking at the general before we go to the females and then the males and then we go to the children. Now we have fatigue, muscle weaknesses, and this is mostly due to progesterone, and this is mostly in ladies. We have frequent urination, ADH, which is antidiuretic hormone, which usually instruct the kidneys to either produce, if you have less of the ADH, your kidneys will remove as much of water from their blood, And in case you have more of that, if you're producing more of that, then you're going to retain much water. And that's why when you take alcohol, it usually inhibits this hormone, this ADH, antidiuretic hormone, and that's why I usually go to the washroom every now and then after taking some few beers. Then we have decrease in sexual drive, and this can be due to estrogen, due to testosterone. So one thing you have to understand is a sign or a symptom cannot specifically pinpoint to a certain hormone. Because, for example, you have issues with your, let's say, insulin. This will lead to your issues with your estrogen because they're kind of related. So you might have issues because, or you might have symptoms due to estrogen. And this might be indicating that you have issues with your insulin. So the very thin line. Now, let's go to the females, the ones that are usually specific for the females. Now, we have heavy and irregular menses, some of which are missed, or maybe they can stop completely. And also, you can have frequent periods, like, for example, you're getting that 2 times in a month. Mostly, this is due to several hormones. Now, you know the hormones that usually control the cycle. We have follicle-stimulating hormone, you have luteinizing hormone, you have estrogen, which is the most important hormone. Okay, it's every other hormone is important, but we have estrogen playing a very major role, and also we have progesterone. So when you have an issue with any of those hormones, you are going to disrupt one of the steps when it comes to your menses, and you're going to either disrupt that or completely stop, or maybe you just start getting irregular periods. You get one after 42 days, you get another one after 3 months, you get another after like 21 days or maybe 16 days. This is usually very messy. So this is a classical sign of hormonal imbalances. Now we have excessive hair growth, and remember you're talking about the females. Excessive hair growths, and this is mostly you're going to find them with facial hair, like the beards. You find them having hair in their chest, and also even the body hair becomes a little bit, let's say, bushy. And this is mostly because of an increase in testosterone. When you have more of that, you see, in ladies, they majorly have estrogen, but they have a tiny amount of testosterone that usually give them the sex drive and all the other characteristics. And if they have more of that testosterone, then they are going to kind of get some male characteristics, and this is the issue. Now, an opposite of this will happen in men when they have an increase in estrogen, like we're going to see. Now, another sign is acne, and mostly it will affect your face. Sometimes it will affect your back here, and also your chest, most of the time, because this is one of those areas with a lot of oil glands. And if you have an excess of testosterone, like we said in a previous video, high amount of testosterone will increase the size of the sebaceous gland, which is responsible for production of sebum. Sebum is that oil that usually comes to your surface. Now, if you have more of this, it means that, now, you see, the duct will remain the same. That channel that will lead from that gland that contains the oil all the way to the skin surface, it will remain the same. Mostly in ladies, it's usually smaller compared to men. If you have a lot of that, it means that you're going to produce more of that sebaceous oil. If you have a lot of that oil, then you have a tiny channel. It means that it will get clogged along the way, and it will attract bacteria, and this is what will come and create that inflammation. And this is the inflammation that will create the spots that you usually get. So this is a classical sign of high testosterone in ladies and other things. So this is just one of the things. Acne is caused by so many things. So you really need to go, in case you have acne, you really need to evaluate so many things for you to conclude the actual cause of acne. So one of them is hormonal imbalances. Another sign is hair loss. We talked about hair growth, but that is when you have testosterone. Also, when you have a lot of testosterone as a lady, you're going to have a lot of your scalp hair growing off, or maybe you have just some tiny patches. This is due to testosterone, and that's why mostly men usually go bald at a certain age because of testosterone. It usually, I don't know, they usually affect the scalp hair, and they usually fall off. Another sign is acanthosis nigricans, and this is the hyperpigmentation of some of the patches where the skin fold, like at the neck region here where the skin fold, under the armpits, on your groin area. This is due to insulin resistance. So if you have insulin resistance, you're going to have some of these symptoms. Another one of which is caused by insulin resistance is the skin tags. If you have a lot of that, it means that either you have a lot of estrogen, this is estrogen dominance, or you have insulin resistance. Mostly they go hand in hand. When you gain a lot of weight, you're going to have so many things that will go wrong. One of which is insulin resistance, or some other factors that will increase either production of estrogen or some chemicals or some compounds that will mimic the function of estrogen, and that's why you're going to have those skin tags. Another sign is vaginal dryness, because estrogen is very important when it comes to female characteristics, and one of which is maintaining of your sexual organ. So if you have less of that, then you're going to have vaginal dryness, and also you're going to have something that we call vaginal atrophy. So when you get that atrophy, you're going to feel that a feeling of being loose, or maybe you're not as tight as you should be, because the cells which are lining your vagina have shrunk. Now let's go to the signs and symptoms in men. Now in men, it's not that complicated. It's a little bit easier, because we are dealing with two hormones, one of which is the biggest of all that defines the men and their sexual characteristics, which is testosterone. And also they have a tiny amount of estrogen, so it is still define their sexual characteristics. Now let's go to gynecomastia. When you have less of the testosterone and a high amount of estrogen, you're going to kind of develop sexual characteristics that are favoring the females. So you're going to acquire female characteristics like the gynecomastia, like the growth of the breast. And also you're going to lose your body hair, like the beards. Another one, very, very common, is erectile dysfunction. I call it dysfunction. It's supposed to be dysfunction. Now, erectile dysfunction. Now, this one is you have less of the testosterone and maybe probably a high amount of estrogen, mostly. Now, this is something that you can actually reverse, but then you'll have to go to the root cause. We're going to see some of this later. Another one, like we mentioned, is scanty hair. So I'm not going to explain this because we mentioned that in gynecomastia. Now we have loss of muscle. So in men, you're supposed to be very muscular, especially if you have a lot of or a good amount of testosterone, not excess, just the right amount. And in case you find that you're not gaining muscles, those that usually define the male characteristics, it might be because you have more estrogen or less of the testosterone. Now, mostly you find that in cases where you have less testosterone, you're going to have a lot of estrogen. Another one is loss of bone mass. Mostly when you compare ladies to men, men usually have a larger or a higher body mass compared to females. And this is because of the testosterone that they usually have. Now, they might also start getting hot flashes. That is due to a high amount of estrogen. This is in men. Let's go to children. I'm going to brush through this very fast, and one of which is low muscle development. Now, if you don't have enough hormones that are supposed to stimulate the growth of your body, you're going to have very low growth. Also, the voice does not deepen when you get to your puberty, meaning you either don't have enough of testosterone or maybe you are overproducing estrogen. Now we have sparsely growing hair, so they are very scanty, and impaired growth. Like we said, if you're not getting a lot of the muscles or maybe the bone mass in your body, then the growth will kind of be stunted. And also, the sexual characteristics. In men, they start developing gynecomastia. In females, you might find that they are not getting their breasts, or maybe their female characteristics are not being defined, and you find that they are kind of getting deep voices, and they're growing a lot of hair, and they're getting a lot of acne at this stage because of the high amount of testosterone. Now in ladies, they're going to experience late menstruation or maybe no menstruation at all if their sexual hormones are not maturing or not being produced at this point. Now we have slow growth, like we mentioned. Hormones usually affect how you grow. Let's have a quick look at causes of hormonal imbalances, one of which is hormonal therapy. You go to maybe a hospital, maybe you want to use those hormonal contraceptives, or maybe there's a hormone with an issue, they are treating that. Maybe there's something that we call hormonal replacement therapy, and maybe you overdose or maybe you underdose. That might have effects, so it's going to imbalance. It's going to imbalance the hormones, and this will have the effect that we have mentioned. Now we have another one, medications. We have drugs which are antagonistic when it comes to the hormones, and they're going to have drastic effects on the levels of hormones that you have. We have chemotherapy for those going through cancer treatment. It usually affects their hormones most of the time. We have tumors. Whether they are cancerous or they are just benign, they usually affect the amount of hormones. Take for example, you have the ovaries. They usually produce their hormones. In case you have a tumor there, it means that a tumor is when the cells overgrow, and when they overgrow, one thing you have to understand that in case the cells which are growing usually produce a certain hormone, then if you have a lot of those cells, it means you're going to produce more of that hormone. Or maybe if they are affecting the production. If you have more the cells that are affecting the organ which usually produce a certain hormone, you're going to have less of that. So if you have a tumor, whether benign or cancerous, you can overproduce or underproduce a certain hormone. So this can totally cause that. Another cause is pituitary tumors. Now, pituitary gland is one of those mother glands. They have effects on almost everything in the body. You might find that it's producing a certain hormone that will go and affect another organ, and that organ will produce a hormone that will go and affect another organ. So there will be a domino effect if you have an issue like pituitary tumors that will lead to overproduction of a certain hormone. So the message will be stronger, and maybe they will lead to exaggeration of the action that is supposed to work on. So if you have issues with the pituitary, it's going to have domino effects. And by the way, pituitary controls a lot of things. Yes, we have eating disorders. Either you don't have an appetite, so you're not eating enough food, or maybe the food that you're eating is not balanced enough, or maybe you have a bias toward a certain amount of food or toward a certain type of food. You might affect the production of your hormones. A good example is insulin. Now, in case, not actually insulin, let's get away actually from insulin, go to estrogen. In case you don't have enough fats in your body, you might underproduce your estrogen, and you are going to have less of that estrogen, and you're going to have the effect of less estrogen in the body, especially for the females. Let's go to stress. Now, stress will lead to production of cortisol, which is a stress hormone that usually have undesirable effects in your body. In case it is stayed there for a long period of time, you're going to have either increased appetite or maybe decreased appetite, and so many other hormones that will be inhibited by the action of cortisol. Now we have trauma and injuries. In case your organ, one of the organ, take for example, you have your ovaries being injured, or maybe you have a trauma there will be no production of some of the hormones that usually control your fertility, your menstrual cycle. And also in men, we have testes. Now that testes, in case maybe you have an injury there and you so happen to lose that, then you're going to lose a huge chunk of the amount of testosterone in your body, and you're going to have the effects of now the increased estrogen. Now let's go to some of the tests and some of the diagnoses that can be done to ensure that we know exactly you have this disorder. One of which is, first of all, there is no specific tests that can be done to like overall gauge whether you have an issue. So your doctor will just look at the signs and try to narrow down to a specific effect. Take for example, you have beard. So your doctor will try to query whether you are having more androgens in your blood. So if they are sending you to the laboratory, they might send a panel of tests, one of which will include estrogen, testosterone. So they are going to use that to know the amount that you have. So there is a normal value that you're supposed to have in a normal human being. In case it goes beyond that, then you have an issue with that hormone. So that's the approach they usually take. Now, we have hormones, especially when it comes to the profiles. We have those that are specific for the men and also for the females. A good example, because this is sometimes it's a thin line. In females, you're going to have a certain range of estrogen, which is not supposed to be in men. And in men, the same thing. Testosterone is high in men and it's very normal, but testosterone is supposed to be low in females because they have estrogen. And we said estrogen and testosterone are usually antagonistic. One will have to be higher and it will affect the amount of the other. So it's usually kind of a huge balance. When you have more testosterone, you usually have less estrogen. When you have high amount of testosterone, you're going to have less estrogen. So it goes both ways. Now, most of the hormones can be detected from blood. Now, we have hormones like TSH, which is thyroid stimulating hormone. We have T4 and then we have T3. These are thyroid hormones and they usually affect most other hormones in case you have an underproduction of this or overproduction of this. Now we have testosterone and estrogen, mostly based on gender. Okay, both can be requested from a single person. Like for example, you're a man, you can be sent for a profile of both estrogen and testosterone. The same thing can happen in females. Now, the interpretation will differ. We have cortisol, can also be found in blood. In case you have a lot of this, and maybe your doctor is suspecting that you have stress, then they can measure the amount of cortisol that you have. And this will indicate a continued exposure of your body to stress. Now, we have now the physical ones, like for example, we have pelvic examination, where they're going to look at the vaginal and look for either signs of tumors and some of the lumps that can grow there. Some of the tumors, some of them might be cancerous, or others are not. So pelvic examination can be a little bit more conclusive by just looking directly at the organ to see whether you have that issue. Another one is imaging, and the most popular one here is ultrasound. If you are imaging the gonads, this is the female and the male reproductive system, you'll have to stay away from the radiation if they are in their reproductive age, because now this radiation can have effects on the sperms and also the ovaries. So the ova in the ovaries can be affected by this radiation, and that's why ultrasound is one of the best things. So you can be able to visualize the effects or the issues that you have. Also, we have MRI, which is magnetic resonance imaging, and this will give almost pinpoint at where you have an issue. The choice of imaging will depend on your doctor. We have others which are general and they look at the fertility. For example, the sperm count. You go to the laboratory, you take your sperms there, they analyze, they look at the amount and the quality. So this will give an indication of whether you have an issue there. We have another test called AMH, which is anti-Mullerian hormone, and this usually indicates the reserves, the ova reserves. If you have lower egg reserves in your ovaries, it means you're going to have less AMH, and this can be an indication of other issues, like for example PCOS, which is polycystic ovary syndrome. Maybe it's occupying, maybe you have a lot of those cysts, or maybe you have something that's interfering with your ovary. So this can be an indication. Let's go to treatment. Now, treatment is a little bit tricky because now your doctor will have to figure out exactly why you have the issues that you're having, and once they figure out where the issue is coming from, then they're going to treat you. Now, we have several approaches that they may take, one of which is estrogen therapy. Now, in ladies, in case you have a lot of testosterone, you can be given estrogen, or maybe, okay, it can be in several forms like you are going to see in the next point. And this estrogen might either bring back the sexual characteristics for a female, or they're going to lower, because they are antagonistics, like we said, they're going to lower the amount of testosterone that you have. Now, we have hormonal birth controls, most of which either contain progesterone or estrogen, but majority usually contain estrogen. We have pills, the birth control pills. We have a vaginal ring that usually give you estrogen. We have copper coil, and also this IUD. It's just inserted all the way into your uterus, and it's going to release that hormone periodically over a long period of time. So it's going to release that amount slowly. And most of them usually have either progesterone or estrogen. So it will depend on the issue that you have. So if they're treating a certain hormone, it will depend with the type that they're going to give you. We have other treatments like anti-androgenic drugs, and they're supposed to lower the amount of androgens that you have, and this will be used in treating that facial hair, that chest hair in females, and also it can be used also in men in case they have an excess amount of testosterone. We have testosterone therapy, where we add more testosterone into your body. In females, in case you have more estrogen and you want to counter a certain amount of that, then you can have testosterone added to try to counter the estrogen that you have. In men, in case you have lower amount of testosterone, you can have that boosted up by this testosterone therapy. And for men, we have a lot of issues when it comes to low testosterone. You might have other issues, a lot of them, so this can help. We have thyroid hormone therapy, like levothyroxine, which usually balance your thyroid hormones, and like we said, they usually have domino effects. If you have an issue with your thyroid, you really need to take care of that for you to rectify any effects that was caused by lower amount of thyroid hormones. We have several in that category. We have diabetic drugs like metformin, which usually treat type 2 diabetes and insulin resistance. This one mostly help those people usually get something like acanthosis nigricans, which is hyperpigmentation due to this issue. So metformin might be used, of which I don't really think this is the best thing or the best approach. If you can know the actual cause of the insulin resistance, then you fix that, then it's better than taking the metformin drugs. We have natural remedies, things that you can do, like adjusting your lifestyles. You'll have to make sure that you lose weight. Always stay within your BMI, because this is the point where your body will be optimal. In case you are overweight, or maybe you're obese, or maybe you are underweight, you are going to have so many issues when it comes to your hormones. When you are overweight or maybe you're obese, you have chemicals that will imitate estrogen, and you're going to have estrogen dominance, or maybe you're going to stimulate overproduction, or you're going to have overproduction of estrogen. When you lose weight, you're going to have less of the fats, and it's very, very, very required when it comes to production of estrogen. So you really need to stay within a good average weight. I cannot overemphasize balanced diet. So if you're vegan, always make sure that maybe you're getting what you're missing in animal products. Make sure you supplement that. And in case maybe you have an issue with a certain element, for example, you have issues with absorbing your calcium, just get to treat that first. And also, maybe you can take supplements in case your body cannot be able to get that in food. Exercises will win every time. You really need to set aside time for exercising, because exercising will have a lot of good effects on your overall health. So you really need to set time for exercising. Stress can be important, especially when it comes to the fight and fight. But when you have a prolonged period of time of that stress, cortisol will have other bad effects in your overall health. Finally, reduce the amount of e-pills that you usually take. And also, if you can get a better alternative away from hormonal contraceptives, that will be better, because now you're not going to disrupt your hormones. I don't know. This is something a little bit debatable, because now maybe you react to copper, so you'll have to use another method. I don't know. You just try to reduce the amount of the hormones that you have in your body, because they are going to definitely disrupt your cycles. Thank you for watching this long video. I'm sure if you watch all the way up to this point, it means that you're gaining value. And make sure you subscribe, because I have a lot loading. And also, don't leave the bell, because I have a lot also loading. So see you in the next video.